Okay. Well, welcome everybody. You have joined the session, Joint Strategies, How Does Sexual and Domestic Violence Prevention Better Leverage Local Health, Justice, and Education Community Sectors? And I see folks from all over with all different types of weather. I'm actually calling from DC where I say it's hot and disgusting. Sorry if you enjoy muggy, very hot weather. And I see folks from North Carolina, California, Oregon, San Diego. I'm sure the weather is lovely there, and all sorts of places. So thank you all for joining us today. Again, for this session, Joint Strategies, How Does Sexual and Domestic Violence Prevention Better Leverage Local Health, Justice, Education, and Community Sectors. I'm Ashley Meyer with Prevent Connect. My colleagues who are joining me today and are helping to back up this session, Abby Sims is here, as well as Dina Fulton. So I want to thank them for joining as well. Prevent Connect is an online community of practice focused on the prevention of domestic, sexual, dating, and related forms of violence. As some of you may already know, we have a website that has lots of blogs, lots of information, podcasts, of course, web conferences and their recordings, and upcoming registration. We have an e-learning site, we have a wiki, and we have a lot of social media. So let's talk a little bit about our technology today. For closed captioning, you can select the stream on the top right of your screen. Everybody, if you could go ahead and raise your hand. It's a little cut off on this one, but it's right over here. I'm just circling it. So that is what you can do if you are wanting some attention. We'll check in with you likely through our private chat. So you can look to the right of your screen is the chat. There's a tab that says public. We'll go ahead and we'll check in with you on that private tab right next to it. We really encourage you to go ahead and use the chat. It's a great way to share information, to connect with your colleagues, and to ask questions and make comments, and we'll definitely be using that today. So thank you for raising your hands. I saw most of you are aware of that function and able to use it. You can go ahead and try to lower your hand as well. We'll see if that works, and then in a second we will lower all hands. The slides today, if you're unable to see those at any time today, you can click today's slides on the top of your screen. It's right about in the middle, slightly to the right, and that will get you back to the slides today. We will ask some polling questions in just a second, and I'll tell you how to do that as I'm asking them. And the phone line tends to have the best audio. If anybody's having issues with audio over the phone, we encourage you to call in. That number is on the top left of your screen, as well as with your passcode. And we ask that folks just use regular web conference guidelines. Just, nice, respectful communication. We really do encourage, if you're going to do one-on-one communication, especially if you want to share your information and you don't want everybody to have your phone number or your email, go ahead and use that private chat. It's a great way to have more one-on-one conversations. And if you're having any other issues, you can call iLink Technical Support at 800-799-4510. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention, and the views and information provided in this web conference do not necessarily represent the official views of the U.S. government, the CDC, or CalCASA. Let's go ahead and ask those polling questions. I am asking a question right now. Hopefully you can all see it. What best describes your organization or agency? So go ahead and click on that screen. And are you from sexual violence agency, domestic violence, dual, college or university, K through 12, state, territory, federal, public health department, or other federal government, tribal organization, child abuse, HIV, STI, reproductive health, mental health, healthcare, LGBTQ organization, community-based organization, and faith-based military. We have a lot of choices here. Criminal justice, Thunder Foundation, or other. So click on that screen. I'm going to go ahead. I'll share the results in just a second. I'll give you more time to click. If you're other, please go ahead and type that into the text chat what are you if you're other? Because we have 5%, so where are you from if you're other? Let's see. I see, State University Victim Advocacy Program. So that is Melissa. Welcome. We have a hospital. We have dual SADV. So it looks like we have quite a bit of folks who are from sexual violence, domestic violence organizations, but we also have some public health departments, colleges and universities. We have some specific issues like child abuse and child maltreatment-based organizations, and a couple, one likely, healthcare, military. So we welcome you all. We welcome the educators in the room. Looks like we have a youth services bureau. So thank you all for joining us. I'm going to withdraw this question, and I'm going to ask you another question that is actually not showing up for me right now. So why don't you go ahead if you are here. We'll do a quick feedback. For whatever reason, that is not showing up, the question I was going to ask you. So let's do, and I'll have to type this into the text chat. So I put a feedback poll there. This is, have you attended a web conference before? So A equals no, B equals 2 to 3 times, and C equals more than 3. So we'll go ahead and do that. There's no need to use D, but let's see. Oh, it looks like, wow, it's all yellow almost. So it looks like we have folks who've been here many, many times, more than 3 times. So welcome you all back. Also welcome those who've been here a couple times. And it looks like there's just a small sliver of those of you who this is your first time on a web conference, on a Prevent Connect web conference. So we welcome you all. Oh, yeah, and there's a lot more C's, it looks like, in the text chat. Go ahead. You can answer that on the left bottom side of the screen. You can just click the answer there. You don't have to put it into the text chat. But overwhelmingly, it looks like we have folks who are coming back, but we definitely welcome those of you who are a bit newer to the web conference format. So I'm going to go ahead. Oh, I guess I don't need to withdraw the question because it wasn't there. Okay, I'm going to close that poll because we're going to use many other. Oh, let me share the results with you first so you can see what that looks like. And that's it for the technology today. So a little bit more about Prevent Connect, and then we'll get onto our exciting content for today. We focused on, as I said, domestic violence, dating violence, sexual violence, and related forms of violence. We really want to look at violence across the lifespan, and we're interested in preventing violence before it starts. So we want to connect to other forms of violence and oppression. We really want to connect those dots. We really are here as a vibrant community of practitioners. That's not the best line, but that was meant to be a line. We're really interested, and that's what we do on these web conferences. We find the text chat very helpful with that, is we connect you all to each other. It's about connecting to your fellow practitioners. We have one more web conference coming up in this series. Today is the July 9th one that you see on the screen. And then on August 13th, we're going to be closing it up, talking about closing the loop, increasing investment and sustainability for sexual and domestic violence prevention. And after that, we will announce our new series for the next year of really wonderful and exciting web conferences. So stay tuned for that. And the registration for Closing the Loop is open. I'll go ahead and put that in the text chat when I am done with this introductory information for you all. Let's get into it. Joint strategies. How does sexual and domestic violence prevention better leverage local health, justice, education, and community sectors? Such an important topic. Those connections, again, are what we're really interested in. Today our objectives are about identifying potential partnerships that are cross-sector. We want to utilize tools that can guide this collaboration process. And we're going to list those joint strategies that are ripe for partnership. So with that, I want to bring in Benita. Benita is from the Prevention Institute, our great partners in this web conference series that we do. Hello, Benita.
Hi. So my focus is really on preventing community violence, so it's great to have this opportunity to facilitate a conversation across different forms of violence and really learn together. So thank you for the warm welcome, Ashley, and from the Prevent Connect audience.
Yes.
So yeah, I mean, I think already the dynamic text chat really reminds me again of what a unique community you are. So it's such an honor to be here. I'm joined by Casey Castaldi and Alexis Kaptanian here, who are working behind the scenes to make this all happen. If over the course of the next 90 minutes you have problems with the slides or the phone lines, feel free to start a private chat with Ashley or with Prevention Institute. And we'll also be sending out all the slides after the webinar to everyone who registered. Not to worry. Let's just focus on the conversation and really just get into learning together about what does multi-sector partnership really look like and how do you start engaging folks on the ground where you work. Before we launch into the content, I want to make sure we're all on the same page in terms of approach. And Ashley mentioned already, the focus of Prevent Connect is really on preventing violence before it starts. That means always returning to this question: what can be done to prevent violence from occurring in the first place? Our focus throughout the series is to sort this out together in conversation. What does really primary prevention look like when it comes to sexual and domestic violence? There's so much value in my mind in the Prevent Connect web conferences, in part because you guys really focus on the upfront prevention, the strategies, the actions that you can take before violence has occurred. And especially with violence, I think there's a tendency to default into these other parts of the prevention continuum on the screen. We really want to intervene when there's a crisis. We need to screen for violence. We need to help survivors heal. Yes, those are all super important things that have to happen. And at the same time, we also need to invest in upfront strategies. This is that sort of left end of the prevention continuum that has the greatest potential to reduce violence, but that also gets the least attention. And I think that's why we spend so many of these webinars really talking about the upfront end of this continuum. What can we do to prevent violence before it even occurs? The Institute of Medicine recently changed their name to the National Academy, but I don't think their position on this has changed either. They're really saying it's not reasonable to expect that people will change their behavior easily when so many forces in the social, the cultural, the physical environment are conspiring against such change. Violence does not occur in a vacuum. It's really about this whole mix of factors. So to really make a dent in rates of violence and to change norms, we have to really work at the environment, really shaping those environments, because that's where people are navigating every day, really sort of being shaped and making choices in that environment. And if we shape the environment, we can really shape behavior, and that will result in improvements in health and safety. So today, what I really want to focus on is to share some findings with you from the Defending Childhood Initiative, and then explore, what does that mean for us as a field? Defending Childhood is a federal initiative to reduce children's exposure to violence. And there are 8 states across the country that are looking at various forms of violence: child abuse, intimate partner violence, community violence. In Multnomah County, which is a guest today, they're looking at trauma more generally. And Prevention Institute is one of the technical assistance providers for this initiative. I recently interviewed a bunch of practitioners working across sectors on this issue. And I want to start by asking the audience some of the same questions that I asked them. So for starters, what are the benefits of working with other sectors to prevent sexual and domestic violence? You could use your text chat and type kind of what are the advantages of working with other folks on this issue. This webinar is really all about joint strategies, engaging other sectors in your work. So, why are you here? What do you see as the value? What are you hoping to learn?
All right, so go ahead. Oh, yeah.
I see Kristen's talking about shared funding. Excellent, kind of pooling resources together to have a greater impact. Sharing data is so important. Reducing duplication of efforts. It's actually when you partner with other folks, you're more efficient. You're able to address things with fewer resources. What else do we have? New ideas, Janie, wonderful. Shared expertise. Greater reach, sort of when you partner with other folks, kind of tapping an even broader network than you would have otherwise been able to reach on your own. Networking with some of our shared ideas. I really like that idea from Rachel because it really brings to the forefront the power of a learning community. kind of when you
And
work.
Benita, oh, go ahead.
Yeah, that's right.
Benita, I really like what Julie says about multi-component programming, and it's addressing the intersections of the community. I like that word, multi-component, for programming.
For sure. I mean, so often people ask, like, what's the program that I need to put in place to prevent violence? And I always have to sort of reel them back and say, it's not going to be one program. It's going to be lots of different strategies and activities that are all working in tandem. So that's great, Julie, that you're really bringing that out. Better and more better. Excellent, Sarah. That sounds a lot like our executive director, Larry Cohen, actually. He's always saying things like that. Ever more, ever more. All right, wonderful. I mean, a lot of what you guys have raised are really echoing the findings from the Preventing Childhood Initiative. Really the most efficient way to address complex issues like violence is to work together. And one of the things I really liked that came up in the interviews was improved trust and credibility with the community. When you work across sectors, you're able to be more effective and have a greater impact and really serve optimally the community. And in that, in turn, the community will turn around and be like, you know, local government and this network of nonprofits is working for me. And that's really going to improve trust and credibility and lead to even more collaboration and stronger partnerships. So that was definitely one of the findings from this project, was that practitioners recognize the value of multi-sector collaboration. And your participation in this webinar is a testament to that. There's value in this, and people want to know how to make it work. But another major finding was that it's hard to do, that systems are not designed for prevention, and they're not designed for collaboration either. So even when you have people at the table willing to work together, the systems, the bureaucracy, like so often they get in the way when they don't need to be. So one of my questions for you guys is, you know, in your experience or from stories you've heard, what are some examples of systems getting in the way of working together? You know, what are some of those barriers to multi-sector collaboration in terms of process or in the way organizations are set up? Ashley, I don't know if you have any stories that you want to share while people type their answers into the text chat box.
Oh, yeah. I mean, I don't want to specifically call anyone out, but I will let you know. I mean, a lot of times we have different funders who have competing priorities, and that, you know, that creates a barrier because we can't necessarily work together on certain funded projects if it comes to having different deliverables.
Right. I mean, I see Heather talks about, you know, competition for funding or agencies being territorial, restrictions, you know, and it's hard to communicate. That's been coming up again and again in the text chat. I mean, one of the stories that I heard from a city employee is, you know, in order to speak to your counterpart in a different agency, you both have to get approval from your supervisor's boss and for people 2 levels above you to agree, like, it's okay for you to have a conversation, which I find so ridiculous. Like,
right.
So like it doesn't seem to make any sense, and yet that's the reality that so many practitioners are working in that makes this kind of effort difficult. So thank you everyone for sharing. The challenges of multi-sector work and the barriers in the way, we're really hoping that this session will give you concrete advice for how you can both sort of work within the systems, like find workarounds within those structures, but also to really figure out how do you change the system itself. Like how do we alter the ways things are set up so it's actually much easier to collaborate across sectors. So today we'll be hearing examples from Pennsylvania and from Multnomah County in Oregon to hear, you know, how are they doing this? And hopefully you'll be inspired to recruit other sectors to prevent sexual and domestic violence and really start figuring out, you know, how do we change the systems so that this is easier for everyone to do moving forward. So I'm going to introduce our 3 guests right off the bat. Abdul Hafiz bin Abdullah is a community health worker, a health promotion practitioner, and a faith community leader. So he wears a bunch of hats. His work really focuses on building healthy, thriving communities, and he works at that intersection of social justice, preventing violence, and holistically cultivating self-efficacy. He and Aaron Fairchild both work at the Multnomah County Health Department. Aaron has worked with communities impacted by violence and trauma for the past 16 years, and she specializes in childhood exposure to violence. She leads the Defending Childhood work in Multnomah County, and she believes everyone has a role in making our communities just, compassionate, and loving. And I think that we all in the audience agree with her on that. Her background is in grassroots domestic violence movement, in child welfare and anti-oppression work, and she knows a ton about trauma-informed practices, engaging school systems, and so many other topics related to children's mental health. So welcome to Abdullah and Aaron. We also have on the line Fern Gilkerson with the Pennsylvania Coalition Against Domestic Violence. She develops training, toolkits, programs on health, domestic violence, and dating violence. She manages the Project Connect 2.0 initiative, which is a network of 6 sites across the state where local multi-sector coalitions are working to prevent and intervene on abuse in adolescent relationships. So we really invited Fern to speak with us today about how 5 of those 6 sites have partnered with schools and with health professionals, and she brings to this work a mix of experience. Because she's been a domestic violence prevention advocate, a birth doula, women's studies instructor, and she has 26 years in social justice work. So I'm so glad to have her on the line with us. Welcome, Fern.
Hi, thank you for having me.
Of course. So Fern and I are going to chat for a bit, and as usual, I encourage you to type questions as we go in the text chat box. We'll be sure to revisit those in a few minutes once we've gotten started. So Fern, I mentioned these 6 local coalitions as part of your intro. Can you tell us a little bit more about Project Connect and why these community coalitions came together?
Sure, absolutely. So Project Connect is a national project in the second round funded by Futures Without Violence and Office on Women's Health. There are 3 different sort of categories that we could apply for when we applied for the grant. So we chose the adolescent health portion of it. When we were thinking through how we wanted to do this, we identified medical advocates in the state as sort of a strong contingency of experts, domestic violence experts that we could leverage their knowledge and their background and the network that we already had. And then we thought about prevention and how PCADV is really committed to prevention, and we felt that engaging school nurses as our sort of core piece to our application and the project crux would really make sense in pulling together the prevention piece and sort of the health promotion piece. So
what was your vision for the school nurses in terms of day to day? How are they going to be incorporating messages about healthy relationships into their work?
Well, what we had asked them to do was be the point person for health promotion in the schools. We had asked them to deliver healthy relationship messages and do the primary prevention piece from there, and then we asked them to be a point person for dating abuse in the school and someone who would refer students who came to them with issues out to domestic violence and family planning partners. With adolescent relationship abuse, it really merges the sexual assault, domestic violence, and family planning issues. So we felt that it was really important to have school nurses, domestic violence advocates, and family planning clinics as a core partnership.
That sounds great. I mean, it sounds like partnering with the school site was an essential piece of being able to reach out to school nurses. Like that was sort of one of the first steps. And school reps tell me all the time that they're always asked to add on to what they're already doing. And sort of what were some of the challenges that the sites encountered and the local coalitions in overcoming resistance and really bringing schools around to this idea?
Sure. So what we had to do first was find domestic violence programs that were already connected to schools. And we wanted that relationship to be in place because we really just needed that. We needed to have that in place to kind of hit the ground running. So whenever we had that in place, we connected with the nurses. And it was usually the prevention educator that made that connection. The medical advocates weren't necessarily already connected. And it was really, it made a lot of sense to the nurses to kind of jump in right away and be that point person. They were really excited about it, but they did run into challenges. And some of those were privacy, the expectation that there would be some private time to engage each student that came in because the messaging was meant to be universal. It was meant to be delivered, that prevention messaging meant to be delivered to every student that walked in because we felt that it was important to the community and social change aspect. So really we're used to engaging girls and educating them about, dating violence, but this took a different twist, the more primary prevention twist, where we wanted to deliver the same messages to anyone who came in, regardless of their relationship status, sexual orientation status, gender, what have you. It was every student that came in was to receive the messaging. So that was sort of a change in paradigm, and we were thinking about how to engage students. Other issues were, as you said, you mentioned this earlier, learning each other's systems and services. We had to really think about, maybe the schools do things really differently than domestic violence systems or family planning, and how can we cross those systems and cross-pollinate? That took some training, cross-training work to learn about what each other was doing. That wasn't, we kind of thought we knew, but we really didn't.
Right, so it sounds like you leveraged existing relationships. So, when a domestic violence prevention program already had a connection to the school, tapping that person who understood the school system to reach out to the school nurses, so that there was already sort of credibility and a sense that this was really in the interest of the schools and the school nurses. Is that right?
That is correct. So the other important piece of the way we did things is that we were also working at the state level. So we had this model where we were mirroring at the state level what we were doing at the community level. So we had sort of a core pod at each of the pilot sites of domestic violence school nurse and family planning partners. Then we had that also mirrored at the state site, where we were working with a state liaison for the school nurses and also family planning folks at the state level to connect us with community level family planning people who would be interested in partnering at the community level. So the expectations were really very similar at the community and state level. We had the community teams working on policy development, and we also had the state level working on policy development. We had the community teams working on replication. We had the state level working on replication. This was important because they had to be mutually supportive, if that makes sense, sort of like a real framework.
Yeah, I mean, that brings to mind a couple things, both the importance of alignment, like making sure that sort of everyone at all levels is sort of on the same page, and how you could link various initiatives into the Project Connect work, for example. And also that communities need support to do this work. It doesn't happen on its own typically, and there's a lot that states can do and that the federal government can do to really make sure that cities are supported in doing this in a way that really reflects the history and the context of the community. What are some ways that you see that the state level work really supported communities and really made sure that their success was maybe not ensured, but likely, I guess?
Sure. Well, each of the core state entities, so domestic violence, PCADV has a membership sort of program. So we worked with each domestic violence partner at the pilot sites. We worked with them to make sure that they felt supported and had everything they needed. We did the same thing with the family planning partners at the state level. We had our state level liaison connecting with the family planning at the local level and making sure that they felt supported. And we also had the same thing with the school nurse. We have a state level school nurse association who is connecting with the school nurses. We communicated often at the state level, and at the community level they were communicating often also, and they also were meeting on a monthly basis at first, and then it kind of spread out a little more later. But communication and trust building were extremely important. So across the board and at those sort of mutually supportive levels also.
So you mentioned how important communication was, and that comes up again and again in our trainings too. When you say you initially had monthly meetings, when you say communicating often, what does that actually look like? Is it emails? Is it people willing to pick up the phone and talk to one another when issues come up? What does that actually look like day to day?
It's all of the above. So the baseline expectation was the monthly community meetings, and then sort of following through with planning that were sort of the result of those meetings that included emails between each other or tapping into me if they had more questions that they needed more information. I ended up really creating a lot of tools to support the teams, such as sample job descriptions. I was asked for a job description that the core team members could, and I was going to get into this in a little bit, but I'll get into it now, that they could share with community team members. The core teams really invited community stakeholders working on adolescent health to join them. And, that was really the way of building, a community of practice and saturating the community more and more. So that was one thing that we did. The outreach component was really important through various levels of the community and communicating not just within the core team, but continuing to make sure that any additional community members who came on understood about the model, what the expectations are, what events were going on, at whatever point they jumped in, what the domestic violence and family planning partners did. So maybe that cross-training happened a couple of times during the grant span. So it happened in the beginning and then maybe a couple of times later on. As far as communication at the state level, we met on a quarterly basis, or we're still meeting on a quarterly basis. And again, it's emails, it's communication, it's working on outcomes, really strategizing together to be able to have some, really concrete things that come out of the project.
Great. Are there any questions in the text chat, Ashley, that you wanted to raise at this point? Perhaps.
I'm sorry, I was muted. Yes, I was muted. There's a lot going on outside of my hotel room right now. So I didn't want that background noise. I have asked some questions, but I am not seeing any questions. I'm still seeing, for example, is it Chara saying that they partner with Planned Parenthood in Vermont. So I think that's really interesting because I had asked if anyone else partners with family planning or healthcare, and it looks like we do have some folks in the audience who are doing that.
I also see Chara mentioning cultural biases within organizations as a challenge.
Mm-hmm.
Fern, has that come up at all in any of the Pennsylvania Coalition sites?
I would say that it came up, probably, well, let me think about this here. It didn't come up as an overt issue. The span of our project sites it was really across different rural, urban, suburban areas, and I wouldn't say that it came up overtly, but we worked a lot again on communication, so I think that it probably came up within the team and it was dealt with. The one, now as I'm talking, one thing that did come up were conflicts between what people's ideas that were going on at family planning and perhaps, ideas about what they could support and when they couldn't support. And what we really had to come back to was the bottom line, that we're all working to, really prevent dating violence and also, prevent teen pregnancy, adolescent pregnancy, unwanted, unplanned pregnancy as a result of abuse, and that's our bottom line. So I would say that's really the example that comes to mind for me.
Yeah, I think having that trust building, that basis for a productive relationship sort of laid at the beginning probably really helped. Ongoing communication, and it sounds like you had such a intensive community engagement process with all the different stakeholders with cross training that hopefully that sort of smoothed the way for you, and it was possible to even have those really frank conversations about cultural biases. I'm not sure if anyone else in the audience wants to chime in on that. But in the meantime, I'm actually really curious to hear, Fern, you've been doing this for 3 years now with local coalitions, these strong partnerships that have come out of it. What are you most proud of about this initiative, and what do you count as sort of your biggest success?
I think having reached, made contact with about 8,000 students with the healthy relationship messaging feels like a huge victory to me, because this wasn't anything that had been done before, really engaging school nurses and really lifting them up as the domestic violence point person in a school, and then really bridging what has really historically been a gap with partnering with family planning and domestic violence in this way, where you're making referrals, really asking them to, sort of look at sort of their notions about how they perceive dating violence, and then really work with that and stretch sort of themselves around doing that universal messaging. And that feels like a really, kind of a big, accomplishment that we had together, between all of us, all of the sites. We were also able to grow with the 6 pilot sites that we had. We started with 17 partners, and we were able to replicate that to 24 partners at this point in time. And, we've got non-funded partners that are picking up the model, and our Department of Health, our Pennsylvania Department of Health, has actually also picked up the model and hybridized it with another model that they have for their 5-year RFA on adolescent health. We've got a toolkit coming because of all of the work that we've done and really building it from the ground up. And we've got a guiding chapter for Pennsylvania school nurses on how they can also use this model and all the tips that lessons learned that we had, to help it be successful in Pennsylvania. So I don't know, it's probably a long answer to your question. But
that's a very long list of successes. We love to hear that. There are some questions on the text chat, Fern, about open mic night and how that fits in with what you guys were doing.
Oh, absolutely. So this was an event that came out of one of our pilot site core team / community team initiatives, and it was an event where they brought together 100 teens because they really wanted to give them a place where they could feel safe and welcome to talk about healthy relationships and have access to advocates or clinicians if they needed to right there on the spot. And it helped out too that they gave away prizes and free food, which always attracts teens. But I really don't think that this would have happened without having 100 teens attend this to talk about something so personal. If that core team wasn't so strong and if the community mobilization didn't sort of feed the success of the site work. And, I really felt that was a really beautiful thing that they were able to bring this many teens together. So that's really what it was. It was a night just for teens to come together and perform and talk and be supportive of each other and have support from local resources.
Yeah, and it brings back for me the comment earlier in the text chat about multi-component strategies, because it's like initially at first glance it sounds like you're really working intensively with school nurses and developing school protocols around interacting with teens on healthy relationships. But just having this poster on the slide demonstrates like there's a lot of other things that are supplementing that work, that are supporting it, and that other partners on the coalition are doing to make sure that it's successful and it's reinforced in all these different settings. So it's great to see that.
So that was a cool thing. The real baseline ask of the core team was that they support the school nurse in delivering the healthy relationship messages, being available whenever students came to them for support, and as a referral source, and really providing any technical assistance or family planning, domestic violence expertise to the nurse. That was the baseline ask. What grew from that were things like teen-only open mic night, or boys' night out or girls' night out, where they came together to talk about health issues, and healthy relationships became one of them. There were Instagram photo contests, teen video contests about healthy relationships, poster contests. Really, each school site also almost had a team of, like an in-school team itself, and that really was sort of an unexpected outcome, where we had one site where the superintendent of the district and the principal of the school joined the team because they felt that this was so important to their school. So I really, it was really neat to watch each team sort of take on this growth in their own unique way. Something else can I mention something really quick that I meant to add in earlier? Something really important to the success of the school nurse was that they have a phone on site for each student to use if they need support. So that it's called what we're calling a warm referral, where if a student came and said that they needed to use the phone, they would have a confidential phone that wasn't traceable by an abusive partner. So I wanted to throw that in as something that was really important to the success of supporting the school nurse, you know, and really not expecting that school nurse to be the expert, but having, you know, a way to refer students then and there to the experts, and that trust and that communication, this was a really important component to maintaining that.
Mm-hmm. Just to quickly address a question by Kristen, you first had to go through the school or the school district administration, right, before you could reach out directly to the nurses? Is that right?
So it depended on the school. Really, we first reached the school nurses, who then reached out, then that school nurse would reach out to their principal or board of directors or whomever they were directed to reach out to. So and how quickly that happened just depended on the school itself.
Got it. Okay, so a lot of it is just figuring out what are the networks of people, how things actually get done, who needs to give approval, and who to get on board. So really kind of doing a little bit of research up front on how, you know, where you work is sort of configured. Sounds like would be a smart first step for people. Is that right?
I think that is, and also coming back to that, you know, that really original sort of strategy of using the relationships that you already have in place and go for that low-hanging fruit. Who is already connected to the schools? Do you have anybody working on the intersections between healthcare and, you know, dating violence who either knows the nurse or could make that easy connection for you? You know, just going in there. And then the other neat thing that happened with, you know, Pennsylvania's Project Connect 2.0 is that other schools really saw it working in, you know, at the pilot sites, and that's the replication went a lot faster because there are other schools in the district that were really interested, and the approval was already there for one school. And so once those hoops were sort of, you know, jumped through for that initial pilot site, the other high schools in the district, you know, they saw the success. They said, this is already in place, you know, let's do it. So it was really, you know, easy to really replicate in some districts because of that. But yes, it is. It was a little more time consuming because of the approval processes in schools. And, you know, that was part of, you know, one of the first lessons learned up front is how are schools doing things differently than domestic violence and family planning. And we all had to take a step back and assess that and really re-plan how we were going to make this work and be realistic about the time that it would take.
Okay. Thanks so much, Fern, for sharing. I know that there are some additional questions in the text chat, for example, from Teresa on the specifics of the partnership. So feel free to continue, everybody, sharing your questions, and Fern will be on text chat with you while we move on to sort of other aspects of our webinar. So thank you, Fern.
Thank you so much.
Yeah, of course. I mean, something I was actually really impressed by with the Project Connect story is how you really went through whatever door was open to you. You know, when working with other sectors, sometimes you have to get them on board and build trust first. And sometimes the way to do that is not an upfront prevention strategy. Sometimes it might make the most sense to work together on an intervention or an aftermath strategy. And then kind of as the prevention voice in that partnership or coalition to sort of guide them toward the upfront end of the continuum when you've already had a track record of some success and that, you know, there's an eagerness to continue working together. I think an important role for all of us. Oh, go ahead.
I was going to say that's exactly what we had to do, and all of the teams have plans. I mean, the grant's ending August 31st, but all of the teams have plans to continue working together because they just feel really bought in and they've built it together. So yeah, exactly.
Awesome.
Thank you.
Yeah, of course. I think that's the important role for all of us is to be that like strong voice for prevention, but also to sort of know when you should be shouting that from the rooftops and when to sort of maybe turn the volume down a little bit for the sake of a long-term relationship. Really trying to meet people where they are so you can nudge them upstream when you have kind of a strong relationship that's already positive and that already sort of has a history of success.
Yeah.
Yeah. see. I'm curious in terms of which sector you guys in the audience are most interested in working in, and most interested in partnering with. So that would be the next polling question. Project Connect, which we just talked about, is one example of working within systems. And I'm curious, sort of for the sake of our guests, to give you further advice on text chat and in conversation, sort of which of these sectors you're most interested in partnering with to prevent sexual and domestic violence. So these are very broad categories. A is education, schools, maybe community colleges. B would be health, public health, healthcare, hospitals. The justice would include law enforcement, courts, family court, criminal justice, probation. And then D is really the community, sort of having those ties with people whose lives have been affected by violence, survivors, faith-based groups. I know that a lot of people will say, oh, these are such arbitrary categories, like this is just reinforcing silos. But it's really helpful because I think this is how the systems are kind of currently set up. And thinking about it this way helps you sort of know how to break it down and understand where they all sort of blend and bleed together. So it looks like currently the most popular answer is education. So I'm glad we've already spent a bit of time focusing on how to engage schools. It looks like D, the community, is also incredibly important. That is true. And health and justice are also coming up as important partners.
And Janie says it's a difficult. Janie says it's a difficult question to answer because all of them are so important, which I think many people agree with. And then right after that, Susan put A, C, and D. So
yeah,
lots of multiple sectors.
Yeah, and this is not a comprehensive list. I mean, we've really talked about how planning and zoning can get involved in preventing violence, how public work,
right?
How economic development, all of these things are so important. It's just that for the Defending Childhood Initiative and the work that we've been doing with that initiative, these are the four that we really focused on. For those of you who weren't really sure which one to pick, I want to share really quickly some of what the practitioners I interviewed identified as a real strength and a contribution from these various sectors. So health sectors were really seen as providing the lens and the vocabulary for a group to discuss the problem and develop solutions. So really when you just go with law enforcement or lens or suppression lens on violence, it really limits the solutions and the partners who can be at the table. But if you engage health, there's this kind of common sense way of thinking about violence that's proactive, that's very inclusive for a coalition to kind of develop a shared language around violence. For education, they were really seen as bridging the grassroots and the grass tops, so bringing both the community to the table with decision makers in government on more equal footing. So if that's something that you see as a gap in your work, engaging education might be one way to address that. I think engaging the community across the board, everyone said that's where you get accountability. Making sure that everything you do is in the best interest of the people that you're trying to serve. When you bring community members into the mix, that's how you know you're going to be able to hold people accountable for what they promise they're going to do for the initiative. And then the justice sector, not many people, you guys identified justice as a group you wanted to engage, but I think they're really the folks who are held most accountable for addressing violence in most places. And so they're expected to lead the conversation, and they really bring the initiative. Like if you're able to convince justice to make room for other sectors, including nonprofit organizations working on sexual and domestic violence prevention, and engage them in doing the upfront prevention piece, I think having police chiefs say, we can't arrest our way out of this problem, we need to partner with other people to do prevention, they really bring a legitimacy to that, to the work, and can help bring others in line and draw on resources. So I want to encourage you guys to consider partnering with justice also if that opportunity presents itself and you think that it's a realistic place to push. Because if you can get justice on board, I think it can really open a lot of doors in terms of the prevention work.
And Benita, it looks like Jody's talking about how they sit on task forces with the police, looks like maybe with judges, DA. So I'm wondering, STARTS, a lot of those kind of multidisciplinary groups do partner with Justice, and I wonder if maybe that was lower because folks are already partnering with them.
Oh, that's a great point, actually, because I asked what people were most interested in, and yeah, maybe that's already an established thing, and you guys don't need guidance so much on that anymore. So let's move on and speak to some of our guests in Multnomah County, where Portland, Oregon is. You'll remember at the beginning I shared that one of the major findings from the Defending Childhood work is that systems are not set up for collaboration, even when practitioners are really hungry for a new way of working together. The Multnomah County site is an excellent example of a systems change approach that's really trying to make things easier for all sectors and issues to sort of collaborate on stuff like this. So keep typing your questions and reactions in the text chat box, and we'll try to address them. But for now, I'd like Erin to unmute herself, and let's get started.
Can you hear me?
Yes, I can hear you.
Okay, great.
Welcome to the conversation.
Well, thanks for having me.
Yeah. Multnomah County's focus on social justice and systems change really is an inspiration to me and to other places. How did you arrive on a systems change approach to this work, and kind of what effect has that approach had on what you decided to pursue?
Well, thank you for that. And definitely we are still, when it comes to social justice, we're still a work in progress. So always, I think our Defending Childhood initiative, I'll talk about sort of why we place a value on systems change and the particular social justice focuses that we do have. But I also want to point out, just to be transparent and fair, that when you look across our county at outcomes that communities, disenfranchised and marginalized communities are experiencing, we're not as progressive as as people sometimes think we are. So I always like to just come back and point that we still have the same disproportionality and overrepresentation in communities of color around poverty and around child welfare involvement and around juvenile justice and school exclusion. So just to be completely transparent, I hope that makes sense. But it's also very motivating for us to look at how all of those disproportionalities are so related to how people experience violence, and how if we want to address upstream root causes, we have to be always looking through and working through an equity lens, particularly a racial justice lens. So that's something that we really try hard to embed in our work. And how we focus on a systems change approach, Defending Childhood looks at all types of violence. So we look at the kinds of violence that happen in families. So obviously domestic violence is one of the primary ways that kids are exposed to violence. But we also look at other ways that kids are exposed to violence in their homes, in their communities, in their schools, state-sanctioned violence, the kinds of violence that happens when communities have disproportionate contact with law enforcement, all of that. It's one of the great, I think, benefits of this initiative that we're so excited that the federal government is looking at how all of these forms of violence are connected. And when we look at how all of those forms of violence are connected, we see that a lot of them have the same upstream risk factors. But then the beauty of that is they also have very similar protective factors. So we noticed early on that our system partners in particular and stakeholders were really tired of all of the same people going to yet another meeting. So what they said in our planning phase was, we don't want to have another collaborative for Defending Childhood where the same people that we work with across all these sectors have to come together for another specific task. We'd rather you, Defending Childhood, embed your expertise and your resources across our systems. So the nature of that feedback meant, and this is something I acknowledge that for people who are carrying a caseload would be challenging, but if you have the luxury of being in more of an outreach or coordinator role, we decided it was really important for us to focus on systems change and embed ourselves across those 4 sectors that this webinar is about.
Wow. Yeah, we've done a few mentions on the text chat that it's a little staticky, so lean back a little bit from the mic.
Sorry.
So the buzzing. But that's really a wonderful approach, really incorporating an understanding of equity and adverse childhood experiences into all of the work. Can you share a couple examples of how you've been able to advance those goals in partnership with other sectors?
Yeah, I'm sorry, I was speaking too close. Is this a little bit better?
Yes, that sounds much better to me.
I'm so sorry to all the attendees.
I'm sure the audience will tell us if it gets worse. They're a very responsive audience.
I got excited and just started talking, and here we are. So how we are advancing the strategies. Well, we get asked this a lot, and I wish that I could say, like, well, here's this new thing that no one's ever thought of that we did that is the magic answer. But really, it has been gaining trust, and I'd say earned trust, and kind of demonstrating an added benefit by being involved in sectors. So all of these sectors, so what that has looked like is me or my colleagues in the Defending Childhood Initiative are on a lot of advisories and committees and other initiatives that have overlapping goals. And it means that in some cases, particularly in the work that we've been developing in the education sector with our school districts, it's taken years of showing up and doing what we said we would do and learning how to speak the language of that system and learning how to shape and package our information and our goals in a way that line up with the specific goals of those systems. So in terms of, I think a great example, well, two that come to mind. One is that we do have a really heavy and deep focus on working within educational settings to promote trauma-informed practice in classrooms and in schools. And that has taken a lot of time and relationship building to build the trust of school administrators, a lot of workforce development. So we've done a lot of free training for schools, and getting access to teachers is a big, everyone wants to train teachers. So that took a lot of trust building through a variety of avenues. We found early on we identified people who had influence in those spheres, but who also were champions, kind of like early adopter philosophy. And we made friends with those people, and then they invited us into the system, and through that relationship it kind of gave us some credibility, and we were able to work together. And I'll just say briefly that right now we have 7 large school districts in Multnomah County, and we're working with one of them in particular we believe that what we're going to do with them after all these years of coordination and working together is a year-long trauma-informed practice change collaborative, kind of like a learning community approach, where we are looking directly at how educational equity, so reducing disproportionality, and trauma-informed practice in classrooms and restorative justice or positive school discipline, we're calling it our 3-legged stool approach, how we can really draw out the expertise of educators that are already excited about those issues to create some systems change and outcome over that school year and over that planning process, if that makes sense. So we're really excited about that.
I mean, I'm already seeing a lot of overlap between sort of like what the mechanisms and processes that Fern used in order to advance a very different program with what you did in terms of, trying a variety of avenues, identifying people who can influence others and be your champions, forming a learning community, so you're kind of all in this together, and then the cross-training element where people really need to learn to develop skills to do this work well, and having them train together and learn together really advances the relationships and the trust also to implement together. So that's really remarkable, actually. I hadn't expected to see so much overlap between what you're doing, because I think at first glance it seems like you're taking very different tacks, and yet the process seems very similar.
Yeah, I mean, when our stakeholders said, and then I can talk about how we've supported the community health worker approach that Abdullah is going to share about, so that really touches again at primary prevention and at community involvement and community-led processes. But when we heard from our stakeholders that they were they didn't want another initiative, they didn't want another collaborative, just showing up, and people always say don't let perfect be the enemy of good, and it really has played out here that we just roll up our sleeves and go where we're invited, and then kind of humble ourselves to hear what we have to learn from each sector, and really just be creative about not letting those perceived barriers stop us from working together. But a lot of it really is not rocket science. It's like showing up and doing what you say you're going to do, and paying attention to how people talk. So if you're in a healthcare setting and they're talking about metrics and cost savings, I have to figure out what that means, and then how am I going to talk about adverse childhood experiences and childhood trauma in a way that speaks to metrics and reducing cost. That's as an example.
Yeah, I remember you mentioning something about the Youth Commission and working with law enforcement. Can you tell me a little bit more about that?
Sure, yeah. And so the Multnomah County or Portland is really, really lucky in that we have the Multnomah Youth Commission, which is an official policymaking body that is led by a coalition of youth. So they make policy recommendations to our elected officials and other leaders and actually drive a lot of change and do a lot of advocacy and really are with a social justice lens. And one of the projects that the Youth Commission has been that for 3 years they hosted a Youth Against Violence Summit. And Defending Childhood, myself and some colleagues were the adult staff for the group of youth that were wanting to address sexual and dating violence. And again, that's an example of, there's an opportunity. They need some adults to fill in. So we think, it's going to take a lot of our staff time, but it's going to leverage so much good information, so much learning for us, and so much resource. So it's worth that time investment for us. So I staffed that youth group for the 3 years during the summit, and then during the Youth Against Violence Summit, we did so that our youth did focus groups with other youth about their experiences with sexual and dating violence, particularly how the adults in their lives address it and maybe how they could address it better. And we've got a lot of focus group data about policy recommendations. And then we hosted a workshop at the last summit about sexual and dating violence. It was again focused on policy recommendations from youth. And when the adult policymakers were invited to attend the sessions, we were just lucky enough that the mayor attended our session, and he had a lot of questions for the youth about how law enforcement could better respond to young people who are reporting sexual and dating violence. And so that got our youth so excited and impassioned. I think they just felt so legitimized that the mayor was talking with them. And so this year, their project that they chose themselves, it's just, I learned so much from them. I really just show up and kind of sit back and facilitate them and their own expertise, but they wanted to do training for law enforcement about how to better respond. And what they landed on is their project is developing a roll call video that will be shown to law enforcement officers that is youth-created, youth-led, youth-directed, that gives information in a positive sort of like we're all in this together kind of, how can we best appeal to police officers. So they're going to be, they just wrote the script, and we have the support of our local police bureau and the mayor's office. They'll be helping us film a professional video featuring youth who will be, just I think expanding the conversation and helping officers understand why young people might be hesitant or have trouble reporting sexual and dating violence and how officers can be the most supportive.
Yeah, that's wonderful. It's another example of the importance of engaging the community, engaging people whose lives are really affected in all aspects of the process, right? Not just sort of running something past them and getting their approval, but having them shape the content, having them be the people implementing. I think that's such a huge asset, and we so often sort of overlook that depth and richness that they could bring to our work.
Right. The youth that came up really thoroughly researched how to appeal to police officers. They consulted with some kind of more trusted, some allied law enforcement officers about how to really package their information in a way that will be received well by law enforcement, but will also, as we talk about, speak truth to power, and how they'll be able to really represent the hundreds of voices of young people that they interviewed in focus groups over the past few years. And they have come up with ideas I could never come up with as an adult that are just so empowered and exciting, and they really give me faith that a lot of good is going to happen as they grow up.
Yeah, it sounds like you've worked so effectively with young people, with law enforcement, with schools, with high-level elected officials like the mayor over the last 3 years. Do you have any last bits of advice in terms of sharing with the audience? What was the biggest factor in your success? How did you do it so we can all sort of follow in your footsteps?
Well, geez. I think that, other than showing up, I think I've already said this, but I think really being able to almost like shift the way that you interact constantly. So the way that I'm going to talk about domestic violence and youth engagement with the mayor's office is going to be different than the way I talk about it with a local grassroots domestic violence provider that we're funding, is going to be different than the way I talk about it with youth. And so I think it really requires putting yourself in the shoes of the person that you're talking to, the entity that you're talking to. So if you're talking with local government officials, you want to be thinking about how is this, to be really frank, one of the things, you want to appeal to their good nature, but you also want to think about how is their involvement in this project going to look good for them politically, right? So you're thinking about already, like, it's a great opportunity for our mayor to support domestic violence because, he's committed to that. And also if he gets to show up in a video where he's supporting it and validating it with that's youth created, that's a win for everybody. So being able to think about things through that lens. And it is a challenge to not lose, to stay true to those ethics of social justice and social change. But really, a lot of people, at least maybe we're different than some other jurisdictions, but people are excited about that and want to do it. We just have to figure out how to speak their language.
Mm-hmm. That's great.
And we just also have to, one last thing I'll say that so much learning I've done over the past few years in this role is that I think, coming from, I came up in the grassroots domestic violence movement and had a very specific way that I talked about domestic violence and talked about survivors and talked about, how I thought about victim blaming and all of the values that we hold as domestic violence and sexual assault advocates. And I really had to kind of, I don't know how to describe it, lower my guard or be patient with people who didn't necessarily have that same language and lens, and allow space for different perspectives and kind of hold my tongue a little bit to develop relationships and really try to understand where people were coming from in a way that was just really new to me when I was just focused on the domestic violence field. I hope that makes sense.
No, that makes complete sense. And I think a lot of people struggle with that, right? In order for the relationship and the partnership to work, we kind of have to start seeing things from another perspective that's new, that's unfamiliar, that we might not entirely agree with, and yet we have to practice sort of seeing the world through that lens in order to connect, to build trust, to sort of move forward together. And I think after I talk with Abdullah really quickly, we'll continue talking about self-reflection and how we can sort of address our own blind spots in order to advance this work in partnership with other sectors. So thanks a lot, Erin.
Great.
That makes complete sense. I'm really, really excited to share the success of the Defending Childhood work in Multnomah County.
Thank you.
Yeah. So something else I found really compelling about what's going on in Oregon is also how you've been able to leverage investments by various initiatives that look at different forms of violence. So really aligning local initiatives was one of those explicit strategies that you guys pursued. So I want to ask Abdullah, even though you work in the same department as Erin, I think most of your work is really focused on youth violence, right? Abdullah, are you there? You might be on mute still. So if you push *6, I think we'll be able to hear you.
There we go. Okay.
Oh, yay!
Hello, everybody. Cool. To answer your question real quick, so we're located within the actual health department, and I think the other part of your question was our initiative through the Center for Disease Control is a focus on youth, but the main objective is really to bring public health to the conversation of violence in general. So we actually address many different forms of violence. But the strategies we're focusing on right now is primarily focused on youth, but that's actually journeyed into a couple different other areas as well, too.
Yeah, so how did you and Erin connect and start working together? Like, was it obvious from the beginning you wanted the same things for the community, or was it a bit of a negotiation at first?
Well, no, that was definitely obvious. As Erin mentioned, she's been very active and being present at the necessary places. That's one of the things that our program had to be involved in as well, too. It's not necessarily for some people, it's not a no-brainer that public health should be involved in certain conversations specifically around violence. So it's a bit of advocating and making that space for public health to be involved. So, and sitting at those tables, we actually found ourselves at the similar tables of Erin, and it was a natural progression. The philosophy of prevention and primary prevention coagulated very easily, and Erin's very proactive. And then our coordinator, Rebecca Sabanjor, they had built a good relationship, and we was able to connect up on many different levels and have done really good work since we've been joined together.
Yeah, so why don't you share a little bit about the work you've been doing and how the partnership with Defending Childhood has really enhanced what you've been able to do?
Yeah, so the direct connection, I think the initial connection was around children exposure to violence. So for us, we're looking at pretty much the social determinants. Why is violence happening in the first place? And one of the things that comes to the table is that what's happening inside these homes, what's happening inside the community, and which, again, the environment affects the human behavior, and the human behavior, usually translates to some form of violence. So the Children Exposure to Violence curriculum was developed through Aaron in partnership with the office I come up out of, which is Community Capacitation Center, which is also the primary trainers for community health workers here inside of Oregon. And that particular curriculum, like me personally, I went through the training. So as a community health worker, I have the community-based connection, and then we get the opportunity to be trained in order to be able to engage on different levels, whether it be educating the actual community as well as sitting at tables to engage the system. So that community, that children exposure to violence piece was really crucial because it led into other conversations about trauma, historical trauma, which really went deeper into the various other factors that really contribute to why certain populations are experiencing violence disproportionately in contrast to other populations. Me personally, one of the good pieces is that I come from a background of lived experience. I grew up gangbanging, spent a good portion of my life, was incarcerated, and having that understanding around the children exposure to violence, adverse experiences to violence, and then just the overall science of what does that do to the mind, what does that do to the overall behavior, became crucial. And I was able to inform the work that I'm involved in. And again, as a community health worker, I sit at 3 different levels. I'm engaged in direct service with community members. I may actually help someone, negotiate some form of conflict that they're having, youth specifically in a relationship with their peers, conflict resolution on that level, or even take a gun out of someone's hand on a community-based level. But I'm also training and using my relationship with the community around understanding why gangs are in our community, why violence is more predominant, why is it okay for us to hurt other people and not really think that it's an abnormal thing, but that it's normal. I'm able to educate now on that level, and then as well as, like I say, sit at the systems and discuss and inform policy. And that's one of the key points about the community health worker, that it sits at all 3 levels. But the most important piece is that it offers the system an opportunity to go access the communities, because we're leaning on our existing relationship with the community. Like, I come from the very community that I'm going to share this particular service to, and saying, hey, look, man, this is okay. We can actually maybe utilize this particular service, because in other cases when you're dealing with violence, we mentioned earlier about the justice system. The justice system in many cases has actually caused violence in the community, and people somewhat feel some trepidation interacting with systems. They've had historical, should I call them challenges, whether it be racism and various other forms of inequities. That barrier exists. So my job would be to go and actually make them feel that it's okay to go ahead and give this particular strategy or this particular organization an opportunity to help them resolve the challenges they're dealing with.
Thanks a lot, Abdullah. I mean, just that whole, that raised a lot of questions for me, actually. I mean, one of them is how a lot of times people say, government's part of the problem. They're a part of the violence and why this is happening for so many groups of people. And I always have to push back on them and say, yes, government is part of the problem, and it also has to be part of the solution in terms of the resources they can bring, the systems change. Like, for a sustainable, long-term solution, they have to be part of that conversation. So it's wonderful to hear that you're really helping people rebuild that trust and figure out a role for them that is empowering and affirming in moving forward in partnership with other sectors.
Absolutely, and it's a big piece of that. It's also about so engaging the community and sharing the language of the systems, because that's also cryptic as well too. Many people, they understand what's going on, but they don't necessarily understand the details of what's going on, how they can actually impact the system. So breaking that language down, but even more so, almost being culturally bilingual and helping the system really understand the language of the community, because there is a disconnect that's there. I believe there's a lot of good intentions, but when you go into the community and you're behaving in a way that you've been trained to behave, a lot of that can disregard some of the sensitivities or some of the actual barriers that you're going to encounter. But when you have that liaison right there in the middle, and again, the big piece about the Defending Childhood Initiative and its partnership with us was that it's also about helping that person with that lived experience and that shared experience building their capacity. So I experienced, multiple levels of training through the program I'm with, Strive, as well as in partnership with DCI. Again, the Children Exposure to Violence was one of the trainings that I attended. But also, once I'm actually being trained and I'm accessing my relationships with the community, and I'm also at the table within these systems, I then also now have the capacity to go and actually teach and go and educate and be able to take those two worlds and bring them together and show how they have to negotiate, how they have to work together in order for the solution to be possible.
Mm-hmm. For the folks in the audience who want to engage a health department, what's your best advice for them? Is it to go through the community health workers, or is it through another avenue, do you think?
I would say at the end of the day, so one of the other challenges too, so the CDC back in the 1990s declared violence as a public health issue. The ideal is that when you have populations disproportionately exposed to violence, that creates that toxic stress. The toxic stress, leads to disproportionate incidents of chronic disease. So the public health has to be there, and it should be there. Unfortunately, although the National Health Department has been calling for that, local level health departments haven't really responded in that particular way. The CDC recently, about 4 years ago, tried to kick off an initiative to hopefully birth that level of ownership from health departments. One of the things I've learned since I've been involved in this work is about really almost taking ownership or helping the public health take ownership of this model that, look, at the end of the day, this is a responsibility that you actually have. And you have a great opportunity to benefit this particular work because you're focused on root causes. You're focused on the narrative. You're focused on the context. Other disciplines, although they may focus on prevention, it's not their primary expertise. It's not what they have to hold on to no matter what else. Public health has to focus on the root causes. That's its strategy. It's the epistemology of public health. So sharing that, not only saying that, hey, look, we need you here, and these are the reasons why we need you. It's almost like you have to educate, and not in a real humble way, educate health officials of the benefit of them being at the table, and then showing them also in that by giving, existing models that actually have worked, how they can actually be an asset to the work. One of the things I've learned is the fact that also the health department has this very unique relationship. The primary people who deal with violence, as we all mentioned today, is the justice system. They use a suppression lens. That can be very hurtful, right? And it has been hurtful to many communities. So it's not access. There's not that much access when systems try to go engage because of that very relationship with the justice system. Public health, when it comes to violence, doesn't have that relationship. It hasn't used guns. It hasn't used handcuffs, and it hasn't use gavels to lock people up and put them in the most violent place in America, bring them back to society where they only can work and live certain places, and then the cycle continues. Public health is saying, look, I'm interested in learning about that narrative. And that's exactly what the communities are interested in learning. You talk to the average community member, they're saying, man, look, this just hasn't happened by happen chance. There's a reason why this is happening. Public health model of root causes, social determinants, and the ideal of obviously upstream solutions. This is the language that communities really want to actually see happening more in their communities. So it's about making that connection similar to what Aaron did, that shared language. But specifically with health departments, it's also encouraging and reminding and also making them aware of the responsibility based on what their philosophy is and what their, again, the connection to chronic diseases and the toxic stress, but then sharing with them what type of amazing work could be done if they took ownership of that responsibility.
Yeah, it sounds like what you're saying is very similar to sort of how folks have already outreached to schools and to other sectors, where it's really finding that common ground, understanding the language that they're using and their mandate, and then drawing the connection to preventing violence, making that overlap very clear, and pointing them to a specific contribution. Does that sound right?
That's absolutely true. And again, I'll just reiterate the piece around having to encourage health departments to get involved in it because, again, from the experience we've had here, that's also been a challenge. And we've been very successful at encouraging our own health department, saying to take more ownership. But initially it wasn't the most, automatic thing. Individuals felt like, well, is that really our lane? And we have some efforts already existing in certain areas, specifically, in the sexual violence. There is some work within the county here locally that does work around violence prevention in that area. But the reality is this, and I'll share this with the audience, is that the sexual violence and the domestic violence is rooted in a baseline de-appreciation for human life. If men are hurting men, believe me, it's easier for them to hurt without any type of sense of trepidation or any type of sense of concern about them hurting each other, because they do it frequently. They're going to hurt women and children even more because the value of human life has been decreased. And so my thing is, across the board, this ideal of sacredity of life, this ideal that, that it's not okay for people to hurt people, has to be pushed across the board. And then very specific areas be highlighted. The misogyny is a big problem across the world. It's something about this era that we live in, and probably eras before we lived in, that it's a huge problem. We can focus even more there, as we need to, which I know this group here does. But when it comes to the public health and other sectors, but specifically public health, violence across the board, and the fact that human beings, whether it be for gangs or because of terrorism or whatever the case may be, have lost or learned to devalue life. So they hurt each other more frequently.
Yeah, I think what I'm hearing is to bring that moral argument as well as sort of the logical argument. Like, it can't just be, here's all the facts, here's why it's in your interest, but it also brings that sort of the moral argument and to revisit sort of the fact that every life is sacred and how to protect that is everybody's responsibility and work. So thanks so much, Abdul. That was very, very moving, and I hope the audience was taking notes, because he basically laid out all your talking points for recruiting a public health department to support efforts to prevent sexual and domestic violence. In the last, go ahead, Abdullah. Any last remarks?
No, I think that's basically what I would share is, first, you guys are doing amazing work, and I obviously appreciate it coming from, because I'm pretty sure other people inside the space also come from communities that's been impacted by violence, but coming from a world where, again, that not valuing life, it is a moral issue, but it's deteriorating our society at every point, from education down to politics on down to our economics, and that's a conversation that's been happening before. So it's a human piece, it's a moral piece, but it's also a fundamental, civilization piece. We're deteriorating as a result of that. So the work you guys do, I just want to say thank you, and I appreciate each one of you guys for that, as well as I appreciate you giving me and Aaron the opportunity to share the work that we're doing here in Multnomah County.
Thank you, Abdullah. In the last 5 minutes or so, I really want to visit really quickly sort of turning the spotlight on ourselves and thinking about how we can be better partners and what skills we need to develop in order to develop these kinds of cross-sector partnerships. So a couple months ago, I saw this photo on Twitter that seemed to perfectly capture the idea of mansplaining. And for those of you who don't know, I can't imagine that folks on this audience don't know, but mansplaining is really when usually a man feels he has to explain something, usually to a woman in a really condescending and obnoxious way, often when the woman doesn't really need an explanation at all on the topic, when she knows plenty from her own experience. I thought this was really hilarious, but it also got me thinking, like, the guy in this statue, he's probably pretty clueless and has no idea the woman on the bench just wants to get back to her book. She's trying very hard not to roll her eyes. And it made me think, what are we doing as practitioners that comes off really poorly to potential partners, whether that's in body language or our tendencies to sort of call people out on like victim-blaming language, for example, which Aaron raised. Kind of things that we do that we don't even realize are undermining our joint efforts. So I'd love to open it up to our guests, to Ashley, to the text chat, to really talk about, what skills do we need to cultivate in order to be better partners across sectors. I think
this is Ashley.
already. Mm-hmm.
Sorry, I was on mute again. So, I just wanted to say one of the things I noticed is, a lot of times we focus on, we have to get people on board, we have to get people to believe in partnering, we have to get them, X, Y, and Z. But what I can tell from this group, at least through the text chat, is, we don't have to do that. People are on board. So now it's a matter of actually taking those concrete steps. And for me, I think the first one is, it might sound simple, but I think folks who've done it know it's not necessarily, but that relationship building. And that can take many forms. It has to be unique to the individuals and the groups and the partnerships. But I think the first thing is trying to form relationships.
right? There's already been a few other comments in the chat about speaking to others with respect, making sure you use words that demonstrate and express respect for others, being willing to start small, develop relationships first before diving into the work. That comes up again and again. And I think already our guests have talked a lot about humility, about going where you're invited, showing up consistently, kind of following through on what you say you'll do. All those things seem so small and yet can have such a huge impact on whether people trust you and want to work with you.
I think something that again worked with Project Connect was those cross trainings that were really an expectation up front at the community team level, because that opened doors to questions that people either didn't want to ask or didn't even realize they had. And so I think it really helped own their listening skills and really consider, the heart of where everybody's meeting.
I would add, too, real quick, this is Erin, that one thing I learned to notice is that in some systems where they just weren't used to someone from the domestic violence or children's mental health or childhood trauma world sitting at their table, I at a very personal, authentic level, I felt distrust. I felt like maybe not so welcome at some of the tables in the beginning. And I think that before this project I might have thought, well, they're just not open to domestic violence information because they're not really willing to do the work or to do the self-reflection. But I just sort of had to figure out how to put those feelings aside and keep coming, even though I didn't feel welcome at first. And then a year later, I feel like we all have these great relationships and we're working so well together. So I think being willing to be uncomfortable, especially when people are different than you or have different perspectives, and sitting with that discomfort and pushing through it has been really helpful.
Erin, that reminds me of something that we learned called strategic questioning that I found really useful through the project training. It just reminded me of that. If you've ever, I don't know if anyone else has ever heard of it, but I wanted to throw it out there.
Oh, Israel, I'll also say too, like being proactive about, and a lot of times there's a scarcity of resources or people scrambling for funding. So if you can be proactive in offering ways in which other organizations can benefit from your presence being there, whether it be social capital, political capital, or actual funding opportunities or whatnot. If you're the one presenting that to the table and having your hand out to give, then that would neutralize some of the barriers as well too, because many of the organizations that do the work that we do, they're not necessarily all the way funded in the best way they need to be.
I see on the text chat a lot of folks are saying patience, patience, patience. That's very true. This stuff can take a lot of time. I mean, Erin was sharing earlier about how it was many years of showing up, being supportive, and doing a lot of the things that Abdullah and Fern were talking about, sort of sharing resources, training together, getting to know one another in order to do the work. Looks like Marissa's talking about being creative, challenging each other to really think, like, what is it going to take to prevent violence as a population level? Like, to be ambitious about what you want to accomplish and realistic about who you need to partner with to get there, even if it is uncomfortable or it is challenging, sort of being poised to take advantage of the opportunities that present themselves. Anyone else want to add a last few words before I share some final resources and wrap up?
I just wanted to say it's not always easy. It can be really painful sometimes to really cross those bridges or gaps and, come back to the place where you need to be and just don't give up.
So what gets you through that, Fern? Like, what gets you through those painful moments so that you sort of come out on the other side? Like, is it remembering kind of the bigger goal, or is there something that you hang on to when things get really tough so that you stick with it?
It's humility. It's the bottom line of the project. It's really trying to put yourself in someone else's place and understand where they're coming from. It's all those things that we sort of know already as advocates, but when we get put in a position that's challenging, it's hard to remember that. So it's kind of reaching back into that place where you remember those advocacy skills for ourselves that we like to, help other people with.
Right. So I'd like to move really quickly and share some tools for the audience that might be helpful in your work. One is Connecting the Dots, which is an overview of research on the links among multiple forms of violence. I mean, Abdullah already made an excellent case for why we have to do this work together. It can't just be one type of violence or another, but there's so many root causes, and resilience factors in common. Another one is building community commitment for safe, stable, nurturing relationships environments. This is another CDC document on really engaging the community in an effort to make sure that all the sectors involved and the local leaders are held accountable for addressing violence and making sure everyone is able to be safe and thrive. And finally, coming soon, we have 3 papers on the Defending Childhood Initiative. Some of these will feature quotes from Erin and others. And there's also a collaboration multiplier analysis coming out this summer on preventing domestic violence specifically that will look at engaging various sectors in California on preventing violence that I hope is really relevant to your work. So sign up for e-alerts at Prevention Institute to get notices on when those are actually on our website and available. And of course, I would love to hear from all of you on how it's going. Feel free to call or email me with questions. My address is on the slide now. And I know all of our guests would love to connect with you too if there's a chance to share advice, lessons learned, and challenges.
Great. Well, thank you so much. Oh, yes.
The one last thing I'll say is that Annie Lyles, who usually hosts these, says hello to all of you, and she had her baby last week. And I'm sure she's excited to hear sort of your progress while she's out on leave. So please stay connected with both Prevent Connect and with Prevention Institute.
Yes. Great. And congratulations to Annie. So this is Ashley with Prevent Connect. We are at time, so I just want to thank everybody. I think we've gotten a lot of great examples and perspectives and had really good communication with each other and advice and insights and all of that. So that's what we hope to do on these web conferences, and we did it today. So I encourage you to sign up for the next web conference on closing the loop and sustainability. That is on August 13th, and you can go to preventconnect.com to sign up for that. In about 30 minutes, you will receive a follow-up email that has a link to the evaluation in it, and I really hope that you fill that out. That helps us determine what you all are looking for in our web conferences and how they're going. So please fill that out. And with that, I will close this web conference out, and we look forward to seeing you online.
Thank you.
Bye.
Thank you.